After that, the microbe activates and causes the spectrum of infectious or the spectrum of disease, no, on the person involved. Okay, how do we recognize the existence of a disease in a person and the different patterns that disease actually show, no, or the pattern of disease progression? There are several predisposing factors that may make the body more susceptible to a certain disease, right? Some of these are enumerated here. We have gender, or more appropriately, sex, climate, age, fatigue, nutrition, lifestyle, drug treatments. Patients which are undergoing to describe a few of these predisposing factors. We have first one, patients undergoing drug treatments. We know, or we somehow we are somehow aware of of the case in which immunocompromised patients, those undergoing chemotherapeutic treatments or regimens, are more susceptible in getting or acquiring infections because their body's immune systems are suppressed. No? Also, another example is lifestyle. Okay, people who are promiscuous, that are not mindful of their sex partners or sexual partners, are more prone to getting STIs, getting sexually transmitted infections, obviously, than those that are more loyal, more committed to their partners, or those that are abstaining, no? Or those that practice abstinence, rather. Age is a very important predisposing factor also. We associate immune suppression or immunomodulation as a person grows old, or if a person is newly born. Very old, very young people are mostly susceptible to infectious diseases. No? And a few. So, in all of these factors may make our bodies more susceptible to a certain infection compared to others. Okay, now let's talk about the progress of disease. Let's have here a diagram. So we're plotting the relationship between the number of microbes and time period. Okay, we're seeing a bell curve. Let us define the different stages of disease. First one is incubation period, which is said to be the time between the initial infection and the first appearance of the signs and symptoms. If we take a look at the diagram, we're seeing that the number of microbes is so slow, or just in the beginning stage of populating or proliferating. We also have prodromal period. It's a time in which the first mild signs and symptoms are noticeable. Okay, so that happens after the incubation period, the prodromal. The third stage, known as the period of illness, is the time in which majority of the noticeable, or majority of the associated signs and symptoms are seen. Period of illness. You can say that the disease is actually at its height. On the other hand, or as disease progresses, the period of decline is the time in which the number of microbes are beginning to steadily uh, decrease, as the signs and symptoms also parallel the decrease, no, or the decline process. And the last stage is convalescence, the time until the body actually returns to the status in which there is no disease. So convalescence or recovery, in which the person is expected to go back, or to his or her normal status before he or she acquire the infection. Alright, so this one, same thing also. Seeing a bell curve, normal curve that represents the stages of disease. Alright, so we've learned so far a lot of vocabulary terms and concepts describing diseases, infectious diseases. Now, let's examine how an infection can be spread. Let's see. Okay. All right. So, spreading of a certain infection